Welcome to 2020, the year of the nurse and midwife, as named by the World Health Organization. Little did the World Health Organization know that citizens worldwide would be dependent on nurses to survive COVID-19, the virus that would become a worldwide pandemic within 3 months. On New Year's Eve 2019, almost on cue, the Wuhan Municipal Health Commission reported a cluster of pneumonia cases. And just 5 days later, the World Health Organization published the first report to the scientific community and global media, with little more information to share. As news became available, as it did for most of us, I showed cautious optimism the World Health Organization was investigating. Despite the growing fears of this new flu, I and 2 of my colleagues on March 8th left the United States to work with nurses at Whispers Magical Children's Hospital in Jinja, Uganda. We form a network of nurses who support nurses. We work alongside our Ugandan nurses to discover what training needs they have, and then we deliver that training through open source technology such as Zoom meeting software and closed Facebook pages. We use WhatsApp to have instant communication, and we use closed circuit TV to assess patients together. And during our in-person visits, we do hands-on training. For example, this last trip, we certified all of the employees at Whispers with American Heart basic life support training and planned our future trainings for the upcoming year. Even though this network was only formed a year and a half ago, we had an independent study done by Makerere University College of Public Health in Kampala, Uganda, which showed evidence of improved outcomes for patients and caregivers. Caregivers, nurses, and physicians who felt more confident and were more competent to perform their skills. Unfortunately, only 3 days into our trip, the alarming levels of spread and severity and the alarming levels of global inaction, the World Health Organization categorized COVID-19 as a pandemic, and we were notified we had to leave the country immediately. We returned to a changed world. The COVID pandemic had surpassed any other public health tragedy from our collective memory. In the 80s, when I began my nursing career as a pediatric emergency nurse, it was the height of the AIDS epidemic. Pediatric patients were the highest population with AIDS, and in a time of fear, much like we're facing today, nurses embraced patients with HIV and AIDS with compassion and gave them hope. When patients were isolated from human touch, it was nurses who reached out and connected with those patients and created solutions to protect themselves and their patients, all without concern for their well-being, for their own well-being. It was a terrifying yet exciting time in healthcare. Our work has been brought to the forefront of the public for possibly the first time on a global scale. And we're grateful for this public awareness. But we enter nursing knowing we will face these types of challenges, and we show up. Nurses have always shown up during healthcare crises. And what you might not know about nursing is our fundamental core is to promote health and well-being. Yes, we're highly educated, professional. We can manage extremely complicated machinery and technology, all while saving lives. But those heroic feats you see us do is not why we do it. And it's not the only place we do it. Nurses are in every corner of the world and provide care wherever care is needed. And we fundamentally do it to improve the health and betterment of individuals and communities. As a global nurse, I want to live in a world where global healthcare equity is attainable. I embrace the first principle of global health, which is equity with justice and human rights in the forefront of my mind. In no other time has there been a truer need for this. As a global nurse, I want to live in a world where global healthcare equity is attainable. I embrace the first principle of global health, which is equity with justice and human rights in the forefront of my mind. And in no other time has this been truer a need. Beyond COVID, we are living in revolutionary times faced with the same problems that have plagued us in the United States for hundreds of years. And as a global society, we have a responsibility and obligation to respond in a manner that shows respect and justice for human rights. Personally, I own these same responsibilities and obligations, but as a nurse, I have the ability now to influence this discussion for possibly the first time in my 35-year career as a nurse. Every tragedy I've witnessed has shown unbelievable silver linings. Silver linings. I know, what good could come away from all this loss? We all have the pictures in our heads. How can you not feel the pain of losing your loved ones? The isolation, the job loss, the economic collapse, quarantine. What about the fear for your nurse colleagues who have rented rooms and homes away from their families to keep them safe? What about the fear of the climbing numbers of nurses who have died from COVID, currently over 600? We are witnessing heroic actions. We might ask, where is the silver lining? What have we gained? Johnson & Johnson tells us, from inventing medical-grade protective masks to developing virtual rounding tools and color-coded improvement communication tools, every day nurses are solving problems that didn't exist 3 months ago. Nurses formed an interdisciplinary team to place COVID patients competently and efficiently in the prone position as soon as it became evident that this positioning proved to improve patient outcomes. When nurse colleagues from major metropolitan cities sounded the alarm across the country of a lack of personal protective equipment, it was nurses who mobilized across the country, across specialties, across healthcare sectors to get PPE supplies more quickly and more efficiently than the hospital system resources did. Then we might ask, what are we to gain? In these few short months since March, it's already been said in the technology industry that a decade of technology barriers have been eliminated. Only 9 months ago, a software development firm told me it cost $500,000 to build what I need to deliver the training and support that I managed to deliver for free with my open source technology. Investors told me, forget about telehealth. Silver lining. Since then, I've partnered with companies who want to bring virtual reality to our colleagues in Uganda. Ministries of health are reaching out to talk about these new ideas and how we can replicate them. Government agencies and private nursing companies are forging new pathways to support nurses. Colleges and universities want to partner on global exchange programs more now than ever. And guess what? The technology has already made it possible to be there from here, from across the globe, to provide as much support to impact healthcare outcomes. Silver lining. But on a more serious note, for any sustainable change to happen, leaders around the globe must engage nurses at every table where healthcare decisions are made. Everyone has suddenly embraced telehealth with a focus on connecting physicians to patients and saying all the right things. What I'm not hearing is how nursing will lead the charge and how decision makers are asking nurses for their opinions and their expertise. And I will share with you my favorite quote by Cornel West. He says, I'm a prisoner of hope. Hope is different from optimism. Optimism looks at the evidence and says, this doesn't look good at all. It doesn't look good at all. Going to go beyond the evidence and create new possibilities based on visions that become contagious to allow people to engage in heroic actions, always against the odds. No guarantee whatsoever. I'm a prisoner of hope, and I am a prisoner of hope. We cannot achieve our sustainable development goals without an interdisciplinary approach, of which nurses are an integral part. It is frequently said nurses are the backbone of healthcare, and it is true. But we must endeavor to lead in a global effort to provide equity in healthcare delivery, now more than ever. The world's health depends on nursing, and the possibilities to impact global health are limitless if we view them through a lens of hope and are given the opportunity to sit at the table where healthcare delivery decisions are made. Maybe we can get it right this time. I hope.